folks, ladies and gentlemen, thank you so much for joining us today at the Business and Professional Coalition Spring Luncheon. I am delighted to bring you together for a discussion of this very important topic, which touches on so many of our lives. I'm grateful to our sponsors, Riley Construction, PID Architects, and RTM Engineering, Lee Mechanical, Kenosha County, Haribo, Kaba, Snap-on, Johnson Financial Group, Wintrust Commercial Banking, LMI Packaging, and Kenosha Community Foundation, and especially also to Kimberly Kane of Kane Communications, who is the steering committee member that first brought up this topic in our meetings. So sponsorships of the BPC go directly to students through the Ralph Tenuta Experiential Learning Fund, which supports internships and other immersive learning experiences. And I'm also very excited to announce that the BPC will be continuing this and other relevant discussions at a roundtable session on April 5th at the grand opening celebration of our new School of Business and Economics. We hope you all will join us for the reception and keynote speaker, Kunal Kapoor of Morningstar Financial Services. And there's more details on your tables about that event that's coming up. So as is our custom, I would like to introduce you all to a very special student, Riley Neltner, a social work major who has spent the last year completing her clinical training hours at a victims advocacy support center that serves children and teens. And before we begin, I'd like also to recognize that this is a challenging topic that we are presenting on today, and I'd like to remind you all that help is always available. Dial 988 for the Suicide and Crisis Lifeline or text HOPELINE to 741-741. Carthage students can visit our Health and Counseling Center just across the hall and can access free 24/7 teletherapy through the YouWill app. And we appreciate that you are with us today. Thank you so much, and Riley.
All right. Okay. Hi, my name is Riley Neltner. I am a senior social work major here at Carthage with a minor in criminal justice. I am the president of a local sorority, Delta Theta Epsilon. I am a recipient of the Carthage Academic Honor Scholarship, and I've been on the Dean's List for most of my college career. For the duration of my senior year, I have had an internship with a nonprofit organization called Belief Survivors, in which I am helping to teach kindergartners the foundation of consent and bodily autonomy. I teach them to identify safe and unsafe feelings, why they might be feeling that way, and what they can do to potentially process these feelings. I am also working with another employee of the organization to develop a new program entitled Project Respect, which stands for Relationship Education and Safety Programming Empowering Community Teens. The main goal of this project is to develop a curriculum that can be presented to 7th grade students about feeling safe in their interpersonal relationships. While my presentations focus mainly on sexual abuse, understanding personal boundaries can be helpful in any kind of relationship. Thank you for joining us today, and let me please introduce our new Dean of the School of Business and Economics, Jim Padilla.
Thank you, everybody. As Riley mentioned, I'm the new and inaugural Dean of the School of Business and Economics here at Carthage College. It is my great pleasure to join an institution with such a robust community engagement. The Business and Professional Coalition is a gravitational force for industry leaders and professionals to share knowledge and drive change on topics that affect the economic development of our region. The topic of mental health is not just a personal problem, but an issue that affects our employees, their families, and the happiness of our workplaces. What we learn here today will help us improve our labor conditions for our workers and create a healthier community for all of us. Before I introduce your panel, I hope you also join us at our grand opening celebration for the School of Business and Economics on April 5th. At 3 p.m. on that day, the Business and Professional Coalition Steering Committee will co-host roundtable discussions with Carthage faculty on topics that will drive our developing curriculum. At 4 p.m., there will be a public reception, and at 5:30, there will be a ribbon-cutting ceremony and keynote speech by Morningstar CEO Kunal Kapoor. There is more information on your tables. Or please introduce yourself to a Carthage Advancement Team member for more details, or even myself as well. Without further ado, please let me introduce our panel. Linda Wogelmuth is Senior Vice President and Chief Operating Officer at Freighter South, with experience in navigating the mental health spectrum From the perspective of a healthcare provider, as well as an employer, Linda brings a unique perspective to the discussion of mental health. Her experience as a nurse, as well as in clinical, operational, and human resource leadership, has given her the opportunity to see how the state of someone's mental health impacts all aspects of their life, as well as that of others. With interest in promoting optimal mental health and knowledge of the healthcare environment, Linda serves as a resource to those who are searching for ideas and solutions. Carrie Foss, Behavioral Health Manager for the Kenosha County Division of Aging, Disability, and Behavioral Health. Carrie has provided behavioral health services in Kenosha County for 27 years, working in both nonprofit and county government. She has chaired Kenosha's Opioid Task Force and Opioid Settlement Advisory Panel, as well as Kenosha's Chapter 51 Committee. John Huggett, Vice President of Central Operations for the Bolt Company. An exceptional communicator and strategist, John leads Bolt's central operations offices in the Madison, Milwaukee, and Chicago markets. His vision and construction experience helps to facilitate central operations, project execution, and business alignment across teams. Additionally, as a trained gatekeeper, John has been a leader in promoting the company's suicide prevention program, aiming to improve communication surrounding mental health in the construction industry. John is a skilled resource for those who may need someone to talk to. Finally, our moderator for today is Carthage's own Kelly Smith. Kelly is Assistant Dean of Student Health and Wellness and Director of the Health and Counseling Center at Carthage College. Kelly has spent the past 15 years serving the mental health needs of the diverse individuals in college and community health settings. She has served as the Assistant Clinical Director for Community Mental Health Clinic, Director of Abuse Intervention Services at a comprehensive domestic violence and sexual assault center, and as a Director of first and second year experience at a medium-sized public university. Most recently, she was an assistant professor and coordinator of the clinical mental health program at a small private college in Milwaukee. She is a past president of the Wisconsin Counseling Association and co-founder of the Midwest First Year Conference, which provides professional development opportunities for individuals working with first-year students and students in transition. Kelly is committed to helping students successfully reach their goals during their time at Carthage College through their positive interactions with the Health and Counseling Center. Without further ado, Kelly.
Testing. Thank you all so much. And just looking at time, I really just want to get started on these questions and see how much information we can get out to you. So post-COVID, national mental health surveys of college students reported up to 89% of students reporting mental health issues that could affect them in their experience in colleges. As we know, mental health influences multiple aspects of our students' well-being, including their ability to focus on their academics and stay in school. So students accessing counseling services continue to report an increase in mental health symptoms, including academic distress, motivation, focus, loneliness, isolation, grief, and including experiences of discrimination and harassment. So the question for the panel is, how do you encounter mental health needs as an employer or as a service provider?
So representing the construction industry, represent a wide gamut of both office professionals and frontline craft professionals who really were significantly impacted during the recent pandemic. Again, deemed an essential business, which we were very grateful that the construction industry we're able to move forward. But in that process, not only the challenge that we were all having of again, the stresses associated with the pandemic, the construction industry is highly rewarding, but then also very, very pressurized as well. And so I think what ultimately happened as a result is we realized that to protect our workers that are delivering construction project services, that we needed to make sure that not only that we were taking care of their physical well-being, providing them the safety gear, providing them the training, But the aspect that was referenced before about how we show up to work every day and the mental component of how we show up to work and the thinking and the decision-making that needs to happen every day in a very critical, potentially dangerous situation such as a construction industry is just really important. So for us, it really just came down to employee well-being and taking care of our employees. So that's how it comes to us every day, both in the office and the field.
Well, mental health is literally my business as the behavioral health manager of Kenosha County, and being aware of its issues surrounding that is my responsibility. So when we take a look at what are the needs at the moment, there are so many factors that play into that. COVID certainly was a huge factor on how we do outreach. Taking a step back, how do we do outreach, and what was our main focus on when we want to reach out to our community in such a shared distress? I want to spend a little moment in talking about stigma. So I'm really thankful that all of you are in this room right now, because I'm going to share some information about stigma that every single one of you can take back to your organizations, to your professional life, to your families. Stigma exists because it's the lack of understanding of mental illness, ignorance, and misinformation. It's also because some people have negative attitudes or beliefs towards it, prejudice. That can lead to discrimination against folks with mental illness. Mental health stigma is the leading factor of poor mental health outcomes. I'm pausing because it's that important. Stigma, mental health stigma, is the leading factor of poor mental health outcomes. That's because people hide their conditions. Feelings of shame lead to avoidance of treatment and inadequate care. Common mental health stigmas include misinformed beliefs about the individual and the disorders they cope with, fueling attitudes that lead to discrimination, marginalization, and the lack of social acceptance. What are we going to do about that? I don't think that we do a really good job as a culture in talking about mental health issues, substance abuse issues. We spend a lot of time and have been conditioned with that maybe none of our business. We don't want to ask those questions. That family's going to deal with that in private. Those beliefs lead to the continuation of stigmatizing folks with mental health issues. So we need, as a community, to start normalizing our conversations regarding mental health needs and substance abuse. This is our business. We need to reach out when someone is struggling at Bolt and say, what's going on? Tell me what is the challenge today or what's keeping you up at night. We can have those conversations. The more we do that, the more we normalize it, the more that we can combat stigma. And if we do that, we can have better mental health outcomes.
So from the perspective of Freighted South, I'm here as not only an employer but also a healthcare provider. And I think that there's a tendency to think that because we're healthcare providers, we have our handle on mental health issues. And to some degree we do. We take care of patients who have mental health issues. But when it comes to our employee population, COVID, the civil unrest that we experienced a couple of years ago, all raised the awareness, I think, of mental health challenges, not only in our patients but in our employees. And so we've tried to do more, I think, to educate people to identify what the issues are and how to identify that someone is having a mental health problem as opposed to good mental health. And through that process, we have, I think, had a great deal of success in working with a number of people. I think as a healthcare provider, we have resources that you may not have, but the bottom line is it still affects the effectiveness of what we can do, our productivity, just like it does you and your businesses that also experience the mental health challenges. Perhaps we're better prepared to address it because of the resources that we have just by nature of what we do. But on the other hand, it's still something that we focus a great deal on. And I think as the other panels have identified, the trauma, the experience of not only COVID, but the civil unrest that we had in Kenosha definitely had its impact on our workforce and how we work with them.
Thank you. That really leads well into our next question, which is about workplace culture. I heard you, John, talk about the well-being and of your employees and that being of utmost importance. Carrie talking about stigma, and Linda talking about resources for employees. So talking about your work and workplace culture, how has it impacted not only your culture among your employees, but perhaps how you're shaping culture as well?
One of the first speakers this afternoon at the podium mentioned 988, and I want to share some information about 988. I'm on Wisconsin's steering committee on the deployment of this for our state, and as we're watching the data that comes in once 988 went live this past summer, the largest increase of callers has been first responders, healthcare, and mental health professionals. So it goes to exactly what Linda had mentioned. This plays an impact on the service providers. And so when we dug into that data a little bit more, we found out that first responders, healthcare providers, other mental health professionals were not interested in contacting a local crisis line. Well, because as a matter of fact, they know people who work at the crisis line because that's their community partner. So they decided to go ahead and utilize 988. What that speaks to is we're all feeling the crisis. So we spend a lot of time talking about 988. We want to talk about that not with just the community, but with our peers. When we take a look at what that service delivery looks like, now that we were in the throes of COVID with social unrest, it was very obvious in 2001 that that idea of a large community healthcare conference or resource fair was not something that we are going to be afforded to do. So instead of taking a look at the needs of the county as a whole, we decided to take a look at the needs of communities and neighborhoods within our county. We did utilize baseline data regarding opioid related activity. So we started gathering information from our local EMS, our medical examiners, our crisis line, and just really taking a look at where are the opioid-related overdoses and activities occurring. So we did a heat map and identified 5 local areas that had the most activity. We then took a look at those neighborhoods and had to make a decision on what else did those neighborhoods need. So we went all the way from dementia care specialists from the ADRC to lead abatement programs through public health, and we customized local outreach. And so was born Human Services on the Go, literally rented a bus and filled it with little red wagons and took the information out and walked up and down the streets, knocked on doors, and met with community members. Now, I don't expect everyone in the community to know me, trust me, believe in the story I say. So before going out, we met with community leaders, advocates, developed rapport and relationship with those folks, asked them to join us on our outreach, to gather some credibility, to be found trustworthy. We understand that there's a concept and a belief out there that local government, why are you here in my neighborhood? So we really wanted to find partnership with that. We built that from 5 activities and providing 500 boxes of Narcan in 2021 to 2022. We had 11 outreach events and provided nearly 1,000 boxes of Narcan to our community. So the idea of providing services in the totality of a county, we're beyond that now. We have to look at individual needs, individual neighborhoods, customizing that experience. So as that perhaps would relate to a company, a large company, that idea that not one policy and procedure is going to really meet the needs of the entirety of your business.
So in 2021, Bolt kind of had a really solid foundation, and it still does, of a culture of focusing on our people. And we're in a people organization. And so when we saw the need in the community of our employees, We embarked on a program, it's called from a QPR Institute, and it was really focused on training gatekeepers. I'm one of the gatekeepers that has been trained. There's 80 of us throughout the organization, and what they are trained to do is to be able to identify suicidal tendencies, or to be able that first line of communication. And we fall within the QPR Institute, really focusing on three main elements, and it's the acronym of QPR: question. First, just engaging in the dialogue with somebody that's just maybe having a hard time. P is persuade, right? So if they are truly in a period of needing some assistance, how can we persuade them to ultimately do the R's, to the refer to the mental health professionals? Gatekeepers, we are not. But we are the colleagues, we are the friends, we are the peers, we are the coworkers that somebody might just be willing to have that conversation with any one of us. And now that each one of the gatekeepers are trained just a little bit more to be able to identify symptoms, or to identify signs, instead of, well, they're just having a bad day. Or our industry, again, can be very challenging. And so the ideas of the competitive, high-pressure work environment, you've got season-ending layoffs that you sometimes have to do with the transient nature of working away from friends and family, but yet that mental strength to work through adversity, and working with this population in the construction industry to be able to balance those tendencies that allow them to push through very challenging, difficult times, but realizing when individually they just need to reach out for help. And so this program has been really successful for us to, one, raise awareness throughout our organization, certainly within the gatekeepers. And we've had just incremental stories of a superintendent who was trained in this, in the QPR training as a gatekeeper. And while not on site, when he went home with his daughter, he was trained to see that some of the signs or tendencies that she was communicating with were telling him that she needed help. So again, while not direct, we're looking at building an employee as the whole employee, not just from the hours that they come in the morning to when they go home at night, but just trying to make a little bit better person in our community. And that was a situation where that training that we provided as an employer ended up providing a significant benefit to him personally in his family. So these are just the anecdotal stories I think that we're seeing now. I'm sure there's more statistics out there, but again, just removing the stigmatization, allowing for the conversation to happen, but that culture of caring needs to exist within an organization to be able to really embark on those conversations.
I think in terms of what may have changed over the last several years and is related to the identity, as the others have talked about, of people who are struggling, whether that's through looking at attendance patterns and suddenly someone who's never had one suddenly has a problem with attendance, just monitoring the normal interactions on a day-to-day basis when you see that someone is just a little off and they may say they're tired, but it's happening more and more frequently. Having people that in your, whether it's a small office setting or a larger company, people that are aware of what those things are to look for. We're fortunate that we have a social worker who is also part of our human resource team. She serves as the senior director in our human resources department, and she is often used as a resource, but I think one of the things we've intensified is, again, having the good fortune of having social workers as part of our employment group, our team of caregivers, is that they are kind of like a walking EAP program. They go around and they're on all the nursing units, they're in the outpatient areas, they interact with people, and they get to know people so they can see when there's a little bit of a change in behavior. And we have the good fortune of having one of them being a licensed clinical social worker who can actually help counsel people and helps other people to learn how to interact with those folks. I think when you see someone who's struggling, we don't always know what to do. We don't always know what to say. And I think that she's given me advice that the most important thing is don't leave those people alone. Don't leave that person. Be with them and then work with them. And sometimes it's just sitting in silence, but it's being comfortable as you can until you can get someone else to help. And I think that's probably one of the biggest changes I've seen. It's always been there, but it's been intensified. There's been so much change in our community, in our organizations, the workforce, that it's been one of the coping mechanisms I guess we've used to deal with that.
Thanks for your answers. And I think you've kind of led us into our next question, which is about how you become aware of these issues. And so I'm hearing you talk about not only looking at data, community data, and also going out and talking to people in the community, talking to the people, your employees and what they need, and also gaining knowledge and doing some training around what to recognize. I'll share here at Carthage also that we become aware of these issues around mental health when students come in and they give us information, and we can actually know a lot. I'm sure you can recognize this too on the panel, just based on individuals' histories, backgrounds, demographics. There's a lot of data out there that can tell us who might be at risk for mental health needs. At the same time, that's just data, and every person is unique and they have their own story and a lot of protective factors and strengths as well. And so it's important to kind of recognize that sometimes it's an acute issue for students. An acute academic issue is a mental health risk factor and a factor that may lead into retention issues, which I know is something we want to start talking about on the panel as well, recruitment and retention issues of employees and addressing that in the way of mental health. So these kinds of awarenesses allow us to kind of target where we can help our employees, our students as they transition into being employees. So anywhere to expand on how do you become aware of these issues, what's most concerning about these issues, and then what are the opportunities?
Well, I'm not an employer, not in human resources, and I don't have a large company to run. But I do know that we all have gut instinct. We know when someone is behaving or acting in a way that is unusual. And as employers, perhaps you're gauging that on time called off from work, late arrival, quality of work not being up to where that person is typically known to be. So this is where I'm going to steer us back and surround us back to the normalization of our conversations. You have an opportunity if you looked at an employee that was limping around the warehouse or the office. You most likely would not ignore that physical limp. You would reach out and say, hey, what happened? Do you need any help? Do you need any support? Do you need any guidance? But do we do that when someone seems more withdrawn or sad? That they're not emotionally under control. Perhaps we don't reach out as easily as possible. So how do we know when things are wrong and what to look for? We know that. You would know your employee, your supervisors would know your employees. You would know when something is off, so to speak. So what we have to surround ourselves is how do we approach that individual? How do you handle that situation? And that's by reaching out and asking. It is your business. Maybe literally, it is your business. I give an example to high school students when I talk to them, and this brings a really good example, and I'm going to share this with you. So there's two friends. One has just been diagnosed with diabetes, and the other one's just been diagnosed with depression. They've been in and out of school. There have been some behavioral changes and some needs moving forward. When your friend just being diagnosed with diabetes comes back to school, you might say, wow, what happened? You had to go to an emergency room? My gosh, you have to take medicine for the rest of your life? Did you go to a hospital? Did you do your schoolwork where you're in the hospital? Now that you have diabetes, what are you going to do? Can you go to my pizza party? Can you have ice cream? Can we go and do the things we've usually done? Parents might reach out to the other parent of that student, ask the same thing. What can we do? Do we need to have certain food? We would include that person. We would ask questions. We would show support. We would even use language like, how brave of that young man or woman. And oh my gosh, what a struggle that family must be going through. Now you have the student with depression. Would you be asking the same questions? Oh my gosh, you have to go in the emergency room? You have to take medicine for the rest of your life? Things are going to be different? Would you as a parent reach out to the other parent and want to know how to support them through this? Would we use language about how brave, what a soldier? Would we use that same language for the student with behavioral health concerns? And so we talk about that because they're both in a health crisis. Both individuals and families need our support, need our concern, need our consideration. So I believe that you would all know the signs and symptoms. What you need is the ability to reach out and have that conversation. I'm going to point everyone to the room to a website, saveliveskenosha.org. There's a lot of information at the back table that I had brought. You will see that information there. That's the website for the Substance Abuse Coalition in Kenosha. There's a lot of material out there for all of you to access, blogs, tools to use regarding destigmatizing the language in your agencies and companies, and how to normalize conversation for all of you to reach out to that person, to the entire family, to help address the totality of the person, not just the mental health concern.
I think some tactical approaches that we've taken is to more formally do our check-ins. And again, as an employer, you do various check-ins, right? How are things going? Are you completing the task? Do you have any questions on the assignment that I had? But I think what we've really done is kind of made a shift in our conversations that we're having about really checking in with the individual employee and just understanding where they are. So ultimately, you need to be in relationship. Yes, you have an employee that is there to do a job or a task, but we talk a lot about employee engagement, right? And I think historically, the engagement of the American worker is like record lows. And so how can we make sure we have engaged employees? And that's getting to know them on a personal level. And so that they feel that caring, so that you can have those conversations with them, so that they can be able to share. So I think one is really our focus on our check-in and how we're going about it. Second, within our organization, we have a full-time in-house health coach. So this is an individual that checks in on a biannual basis with each employee and talks about whatever that employee wants to talk about. She's also available to have other additional discussions outside of those 2 times a year. But that resource, again, the woman that I'm referencing, she actually championed this QPR program, and I'm grateful for it. And when you have champions that take ownership of a program, you get traction and you get implementation and something gets done. You had 80 different people throughout the organization that wanted to be part of it, but you needed a champion that was going to lead it. So that's been, I think that's a second really tactical component of that. So check-ins, making sure that we're connecting with our employees, developing relationship, and having this health coach, and then also having the training of the program. I did bring just a couple handouts for those that might be interested to get training in the QPR Institute. There is local training available. There's online where, as a nationwide company, we chose to do the more online program, but there are also services here locally for training within your team as well. As a business owner, as a leader within our respective organizations, I think we just need to figure out how do we provide that environment that allows our employees to flourish.
Just to comment on what I've mentioned before about the walking EAP programs and whatever, I think that the biggest concern is not identifying that there's a problem and allowing someone to have a concern, and it doesn't, whether it's treated or not, but the concern is that it's not identified. And I think we've all been touched by people who have been hurt by not having a good state of mental health. And obviously it can be devastating when it gets to the worst case scenario. And so secondly, to not identifying the issue is not having the person who's suffering have hope that there's something out there that can make it better. And I know what you mentioned, our social workers, if there's resources we have that you might benefit from, happy to respond to any questions you might have in ways maybe that we could find resources for you. But I think making sure it's an area that we're not comfortable with. And I know there's a stigma to it, but I think people in general are just not necessarily comfortable dealing with someone who is depressed. What do you say? What don't you say? How do you interact with them? And there is no one answer for everyone, but certainly there are resources there. As Carrie and John mentioned, there are resources available even on the NAMI site. I think there's resources to help people understand what you might be looking at when you see someone. So I would say encourage people to use those resources as well.
Thank you so much for your answers. I'm hearing creating environments. I'm hearing not only identifying issues, but approaching them and opening the door so people in the community can walk through it at the time they feel like they need to access those resources. I just want to take a second to share a little bit about what we're doing at Carthage to kind of create this culture of care as well. Over 200 of our faculty and staff have gone through mental health first aid training, so that training is important to be able to recognize those signs and know what steps to take. So a lot of people are in that situation, and then what do I do next? They might notice what's wrong, but without the training and support to know what's going to happen next or what they could do to support that student is really important. The next thing I want to share about is we have a program here called Navigate, which is actually a software program, but what it allows us to do is communicate across campus to share information on our students if they're experiencing an issue, whether that be financial, whether that be mental health related, whether that be academic related, or a family issue that comes up. If a professor is notified, for example, like I had a death in the family, then we can get them to a resource where they can manage their family situation, and communications with their professors can be taken care of so it's not stressful, and we just try to work together to create, I kind of like to say it, we kind of wrap care around our students. That's really what we want to do here, so they can do the things that they came here to do, be academically successful, graduate, and be productive, giving citizens. So in your view, how do you think that the spheres of employees, student, and public mental health are connected?
Well, as an employer, we're hiring the students that are produced here at Carthage College. So we have a very close interest on the well-being of the students that are being prepared for the workforce. So we feel that it's a really important partnership to make sure that business and education are very closely connected. So that when we can communicate of what are the attributes, what are we seeing in a student that's produced, and how can we partner to be able to provide that quality of student. I think when it comes to industry, we again, even with the Gatekeeper program, we have an awareness, but we are not professionals. So we must partner with individuals and organizations in the community that can provide these needed services. But we need to know what they are, and we need to develop those relationships so that we can reach out. So I think it's all connected, each one of our respective worlds, and I think forums like this just allow for those connections to be made, to be able to just be more supportive of our employees, and bottom line is our community.
I really would like to add, I can't thank Carthage enough for bringing us all together today surrounded this topic. And here we are all together and an opportunity to say, I'm Carrie Foss. I'm the Behavioral Health Manager for Kenosha County. And if you have a business in Kenosha County and need some more information about what is in fact available here, I'm going to stay around for a little bit and I'll provide you a business card to Lisa Kanan, who is the county's outreach coordinator as well. So we can talk to your human resources or your EAP to let you all know what is available. Not only what's available for someone to make an appointment and do some traditional treatment, but all of the services that are available in someone's home free of charge and can be anonymous. That's as powerful a tool as anything else as well. So here we are together at this intersection of student and healthcare and business provider. And so we can move this forward instead of just leaving the lunch and thinking, well, that was really interesting. I hope you're thinking that. But to be actually make a connection and take this information back not only to your businesses, but to your family and friends as well.
I guess I would just add that we are all here together representing all of those spheres, and many of us use students in our employee, to work with our employees to proceed to succeed in our businesses and increase productivity, or train people for future positions in our businesses. And I think as we look at just our culture in general, in talking to a few friends over the last couple of days, hearing the differences in the education world of how different schools do different things, and some of your children or your grandchildren end up with homework, others don't. They go to high school, they end up having homework, or they go to college and they're on their own for the first time. You know, this issue of mental health is such a multi-dimensional issue that there is no one answer for it, and we are faced with it in every one of those spheres, I think. And so I think many of the solutions or the suggestions that have been mentioned can work in all of those areas. You just have to tailor it to that particular group of people. So again, I'm grateful as well for Carthage doing this.
Yes, there's many pathways to mental health. So I thank you for sharing that. I got an eye on time. I really want to leave some time for questions. And Kate's over there. She's got the mic for some questions. While you are thinking of your wonderful question, is there any last minute kind of, I don't want to leave this panel without having the audience hear this one thing?
There is help available in Kenosha County. We hear a lot that there's no help available, there's not enough help. I can't qualify if there's enough help because I'm always going to want more providers, more services. But there are several phone numbers that you can contact. One of our greatest assets in Kenosha County, and there's only 2 in the entire state, is the Mental Health and Substance Abuse Resource Center. And there, again, there's information in the back of the room on how you can just call. You don't have to be in crisis. You can be anonymous. You can be the employer, a family member, a person. You don't have to know what to ask for. You have to be willing to share your story with a resource center worker on what your challenge is, what keeps you up at night. You don't have to know what to ask for. I think that is the biggest barrier when people don't ask for help. What do I say? There is no script. You share with us your story, and then we take it together as a team.
I would just like to take the opportunity of commenting on, I think, 2 of the real examples of things that people can do to support mental health in our community, and one of which I will say on behalf of healthcare workers is what occurred after the inception of COVID. And we were all faced with the crisis of people having this illness that none of us understood, and the healthcare workers of just about every level really going into crisis mode and doing everything they could to try to literally save people's lives. And the reaction to the community of the way that the healthcare workers were recognized with food donations and recognitions in the paper, and the drive-by with the headlights and the flyover of that was brought on by the Air Force, I believe it was. All of those things were so encouraging and so supportive of the people who were struggling. And the other is after we did have the civil unrest. And I brought those issues up because I think in our community, those are two things that really impacted people in so many ways that we probably don't even know all of the ways they impacted people. But the rallying of people to try to make our community beautiful again after we saw the devastation during the riots. And those are real visible signs of what we can do. But I think making sure people who are struggling in whatever way it is just know that there's hope there, and finding ways to be comfortable with that. And if you're not, finding someone who can. So again, thank you to all of you who participated in any of those things. I think that was a real tribute to our community as to how we react to people in need.
Educate yourself on the available resources. Ask yourself what culture you're creating within your organization that does provide the psychological safety for these conversations to happen. And then I think ultimately lead with empathy. I think that's what's really needed right now, is really strong leadership within each one of our organizations. So.
Thank you very much. And so we're ready for some questions.
Well, if we could answer that, we probably would be published in some sort of workforce development journal. I don't know how to handle that, but you bring up a great point that facilities are full, not because that every bed is at the capacity, but because every bed that they are staffed for is at capacity. And so we could potentially have a higher utilization of not only mental health facilities, nursing homes, adult family homes, CBRFs, assisted livings, if we could bring up the professionalization of the folks that are in that field. Not only the professionalization, but the compensation they receive for that. And so if you could take a look at, and if we could figure out how to really bring up the average wage of a CNA, or of a mental health tech, or of a social worker, that would be genius. So I do appreciate, I don't have an answer for you, but I appreciate your acknowledgement of that very dire situation. Kenosha County has really been afforded this great opportunity to look beyond just Kenosha and, quite frankly, just Wisconsin and our mental health facility beds. And so there's a lot of work in motion to be able to cross state lines, to be able to access facilities in Illinois. And hopefully there's some news to come about that very soon.
So if I can comment, not specifically to all your questions, but in terms of something that Frederick South is right in the middle of right now, and some of you may have seen in the newspaper and other documents or whatever, that some have said that we have opened a mental health inpatient and outpatient unit. That is not quite accurate. May have been confused with our physical rehab unit that is under construction at the Kenosha campus. But we are in the midst of talking with not now just 3 entities, but now 4 entities, national companies for the most part, that are looking to place inpatient mental health beds at our Kenosha campus, as well as 2 of the 3 for sure looking at outpatient facilities. So clearly it's been identified not only by the Kenosha community that we need mental health, care and more treatment facilities, but by these outside entities who have identified Kenosha as a place that would be beneficial for them to place these facilities. And they would be leasing space, so it would be their hospital within our building. And as far as the wages and benefits and finding the people that would work there, I do know from the nursing side, there are nurses who love mental health and love taking care of mental health patients and patients that are suffering from various different diagnoses. And sometimes it's not all about the money. Sometimes there are people that just want to do what they're doing, but we're always trying to be competitive, and those entities that might end up with the space will obviously have their own systems for how they compensate staff. And there's some creative staffing out there. There's creative compensation packages with salarying people that historically haven't been salaried. And so hopefully within the next few months, we'll have that process resolved and we'll know what we will be able to offer. And I think we'd all agree that it's something that we need in our community, and hopefully we will be able to work through all the details to get there.
Any other questions?
The question is how to combat stigmatized targets, the individual who is feeling the stigma within that own family system. And that certainly is an ongoing issue. There are cultural beliefs around being stigmatized. And I will tell you that those of us in the behavioral health field, we're not here by accident. And so I will share a story of being raised by a woman who is immigrated. And she had mental health concerns. She had a lot of mental health challenges. This was in the 80s, and I was much younger then. So was my voice, was my education level, was I at a place where I could help combat stigma? But culturally, we can't blanket statement how to combat stigma. She was put into a box of, she's that overbearing, nervous, neurotic Italian grandmother immigrant, right? With very little education. And she was the worrier, and she was constant, and there was, some conspiracy theories. And it was stigmatized not only because of her immigrant status, but because of mental health as well. And so I don't think that there's a good answer for that. But I do know the antidote for stigma is education. And so here we are here now, telling stories, having information. This is really powerful. And I've said this a few times before, I'm gonna say it again. Please take the information you're learning here to your companies and to your families and to your friends. We have, the panelists have afforded everyone a wealth of information. It's hard to process all at once. And again, that's why I really want to point everybody to saveliveskenosha.org. There is so much information on there about stigma, so much information.
I can say that at our Health and Counseling Center here, about 50% of our students who report a barrier to care report that it is because of family issues. And so being able to access care here is incredibly important to them, because we are able to help bridge that and help them get to a place where they feel healthy and able to pursue their goals while also maintaining that usually very important relationship with their families. Also, nationally, counseling centers, students are reporting that increase in trauma. That's something that we've seen since COVID, and not just trauma in the past 6 months or 1 year, but trauma from 1 to 5 to 1 to 10 years ago. So growing up, And so I think that may be to reduced stigma, that we're seeing more students feeling open to address some of those issues coming here to college, which is great because we know those things need to be addressed. They're still there whether we see it or not, and that's really important.
You were talking about how to identify somebody who is having mental health issues, and I believe that's important. My question is to the long term, as an employer, for instance, somebody who might certainly have or be through a process of depression. It could be days or weeks, but somebody who lives with bipolar disorder is living with that the rest of their life. How do you accommodate? So how can you help that person who will have crisis at some point, who will need days off, who will be unable to work? How do you help them on the long term so that they can remain employed, that they can continue their process, and without being concerned that the first crisis is going to cost them their job, for instance?
Well, I think it's a combination of the knowledge of the employer, right? And making sure that we are interpreting the support the employee needs. I think it's also making sure that we understand what community partners are available to potentially help and provide assistance in that. And then it is a balance to make sure that the responsibilities of that role or task that individual is being asked to do within the organization, they can continue to successfully do that to allow us to continue to move forward as an organization. So again, I think at the heart, it's making sure that the respect for people is at the heart, and also and really understanding what are the needs of that individual, and then trying to determine how best to support them.
I would agree with what John said. I think also not knowing the size of your business or whatever in terms of the benefits for FMLA and having people have time that they can have off if it's going to be predictable. I know that's one of the things we face, and there are people that have anxiety disorders that need to be able to, whatever triggers them, they need a day off, and it makes it very challenging to make sure you have enough people doing the work when those things happen, but there are options for that, and I think too, finding a position, it may be something in their work that might trigger some kind of a reaction that makes it difficult, and dealing with the whole work environment too to make sure it's most effective for them to be able to continue to work. But that's a real challenge that I think we all face, is how do you do that and trying to keep your business going with the employees, and these are good people and they want to work, and yet they can't sometimes. So
Thank you all so much for coming and for offering your questions. Thank you to our wonderful panel. This has been really edifying. I'm grateful for all of your insights and your suggestions today. And I just want to call attention to our Aspire team. So any of you employers out there are interested in hiring Carthage students as interns, those are your go-to people. And this program also supports the Aspire program and the Ralph Tenuta Experiential Learning Fund, which supports internships. So I would like the Aspire team to stand up, and if you're interested, please connect with one of them. And please connect with me or one of our advancement team to discuss anything else that might be on your mind. So thank you all so much. And